For the next orthopedic issue which we'll be discussing this evening is the chronic CPPD. Now, if you look at this, CPPD just simply means calcium pyrophosphate deposits. Okay, so you are having a deposition of what? Some crystals, all right, of a mineral, okay, combination known as a calcium pyrophosphate. Okay, do you understand? So that's what we actually call CPPD. Do you understand? But if we are saying this chronic, that means we are saying this deposition has been there for a very long time. Do you understand? So it sometimes refers to as what? Pseudo rheumatoid arthritis. All right, so when we are saying it is chronic, it has been there for a very long time. You understand? So it's a persistent, it has been there for a very long time. It's an inflammatory joint condition. It's caused by buildup of the calcium pyrophosphate dihydrate crystals in joints. Do you understand? So of course, the issue that this patient is actually experiencing, inflammation, pain, stiffness, all of that is there. You understand? So unlike the acute form, which presents with sudden flares, the chronic one is the one that has taken over a long time. Do you understand? It mimics other long-term disease conditions like osteoarthritis, rheumatoid arthritis. Do you understand? But it is not them, because then they are caused by uric crystals. Why this one is caused by what? Calcium pyrophosphate deposits or crystals. Do you understand? That was the difference. So key features. What would be the problems that such a patient will be facing? How would the patient present? So persistent joint pain and stiffness. That means because the disease condition has been there for a very long time, the issues that this patient has faced to have been there for a very long time. If you take the history, okay, so swellings and inflammation, progressive joint damage, then variable presentations. Do you understand? It just depends on how the immune system of the patient is kind of like reacting to the disease. So diagnosis, x-rays should show you the crystals deposits. All right, you can see various x-ray images here with, you know, the arrows trying to point where the deposit is at. You understand? Then blood test, okay, synovial fluid analysis. All right, so treatment strategies is there's no cure for it, but you are trying to manage all the symptoms that the patient is facing. Do you understand? For inflammation and pain, you use non-steroidal anti-inflammatory drugs, colchicine to help reduce the chronic inflammation, then corticosteroids also to handle the inflammation, of course, because basically inflammation and pain is the issue that such a patient is having. You understand? So lifestyle support, physical therapies, like just keep on doing some 1 or 2 exercise, keep the joint in use. You understand? Because that will at least maintain some 1 or 2 flexibilities. You understand? Assisted devices which will help you with your daily activities, okay, and all of that. So methotrexate and hydroxychloroquine they are kind of like investigating them to see if there's a possibility where they can use them on these disease conditions. So that's it for CPPD.